If you think you have erectile dysfunction, also called ED, or have already been diagnosed with ED, there are many treatment options available for you that may help regain control of your sex life. It can be helpful to learn more about the available treatment options, and I will work with you to determine which solution for your erectile dysfunction might be best. Treatments for ED include oral medications, penile implants, penile injections, vacuum erection devices, insertable medications, and more. Oral medications with names including Viagra, Cialis, Levitra, or Stendra are the most common type of treatment for erectile dysfunction. Typically, oral medications must be taken at least 30 minutes prior to sexual intercourse. This allows them to produce an erection. An option that many people are not familiar with would be an inflatable penile implant. The Titan made by Coloplast is a penile implant that can typically be placed in an outpatient setting, and it provides a long-term solution for erectile dysfunction. These implants were designed to mimic the look, feel, and performance of a natural erection, and are placed completely inside the body through a small incision either in the scrotum or abdomen. Another treatment for erectile dysfunction would be penile injections, which require you to give yourself a shot in the penis 5 to 20 minutes before sex to get an erection. Vacuum erection devices are also another treatment option for erectile dysfunction. They are external pumps consisting of a cylinder and pump that is placed over the penis and pumped to create a vacuum that pulls blood into the penis, creating an erection. Once erect, a constriction ring is slid down to the base of the penis to help maintain that erection. And finally, a less commonly prescribed treatment option would be insertable medications. An applicator containing a small pellet is placed into the urethra, which is the urinary channel, and that pellet is released. The medication in the pellet creates an increase in blood flow to the penis, which can help create an erection. Oral medications have been proven to be effective for many, and over 60% of men are able to achieve satisfying erection using these medications. Although oral medications work well for many, they don't work for everyone, and nearly 40% of men don't respond to them at all. Also, if you have certain pre-existing conditions and are taking certain medications such as nitrates for chest pain, this treatment option really may not be available to you. With these medications, you could experience side effects such as headaches, flushing, upset stomach, pain, muscle aches, and nasal congestion. When oral medications are ineffective or not available, penile implants can be an effective, long-term erectile dysfunction solution. This ED solution allows for spontaneity and puts you back in control of your erections without the hassle of pills, needles, or clunky equipment. It's very reliable, and erections can last as long as you want them to. Like every surgical treatment, there are potential risks with penile implants. The most common risks of penile implant include, but are not limited to, device malfunction such as break or leakage, infection, inflation difficulty, erosion of the device, incorrect sizing, and they can make latent natural erections as well as other treatment options impossible. Penile injections are another option. These treatments work very well in some patients, however they do require you to self-inject medication into the penis rather than taking the medication orally. They can be a bit cumbersome, and some brands require refrigeration, and they can take 5 to 20 minutes for activation. Also, in up to 30% of cases, penile injections are ineffective or can cause priapism, which is an erection that lasts 4 hours or more. This can require a trip to the emergency department. Other side effects include penile pain, numbness, irritation, bruising, scarring and fibrosis, and other issues. As I stated earlier, vacuum erection devices are external pumps that are placed over the penis. This option requires no oral medications, injections, or invasive procedures and does work well for some men. Patients who use the vacuum erection devices may have a learning curve. They may have discomfort, and they may find the equipment to be bulky. You may also experience an erection that is cold to the touch, or you may not achieve sufficient erection for sexual intercourse. As mentioned, insertable medications are pellets that are inserted into the penis through the urethra. These are not all that commonly used, and erections usually start within 10 minutes and last between 30 and 60 minutes. The side effects of these medications include burning and aching in the penis, as well as burning with urination. These medications may require refrigeration, and they can diminish spontaneity due to the nature of the preparation. Every patient is different, and every man's journey with erectile dysfunction is different. I look forward to the opportunity to sit down with you and assess your specific situation, your expectations to create a treatment plan that's right for you, and your goals for your treatment. Not only are penile implants an effective and reliable solution, but they also have the highest satisfaction rates among other treatment options. A study of Titan penile implant patients reported a 98% satisfaction rate. Their partners were also highly satisfied, reporting a satisfaction rate of 96%. One of the long-term consequences of not having erections is the loss of penile length. Like any body part that goes unused for a long time, the muscles and fibers of that body part begin to break down. If it's been a long time since you've achieved a good erection, you may experience loss of tissue or even atrophy that can result in shortening of the penis. Additionally, given that the arteries to the penis are smaller and prone to earlier blockages, ED can be an early indicator of other health issues such as cardiovascular disease. These are important issues that require evaluation from a medical professional.